Well, welcome to Hamilton County Newsmakers. Of course, I'm your host, Perry Williams, and I'm on each week and I always try to bring Hamilton County Newsmakers, and I have a couple of them here today, Janet Guffian and Holly Wheeler.
Yes.
Welcome, both of you. And I guess we're going to talk a little bit about partnerships for a healthy Hamilton County. And Holly, I understand this is kind of a new program.
Yes, it is. Janet and I have been on staff since January. We are a data-driven community partnership that is focused on advocating and implementing for improved health in the county where people live, work, play, and learn. So we were actually born from a community health needs assessment, and perhaps Janet can kind of go into that a little further to address some healthcare needs that were identified by a group of health organizations. So we are really focused on, we didn't just pick what we're doing, we have some, there's research behind it, and that's why we're going down the road we're going.
Okay, Janet, tell us a little bit about how this program got started and some of the background to getting where you are today.
Well, there was a county and a kind of a Hamilton County task force that started, and also our collaboration with hospitals. Hospitals are required as nonprofit agencies to report to the IRS a survey of results and tactics based on a survey they do of the community. So what they are required to do is go out and do an assessment of needs that are perceived needs by community residents in the community. So the hospitals that were involved with that we were working with currently is St. Vincent, the IU Health System, Community, and the Franciscan St. Francis. And they got together, and as they did their assessments and worked with that, they came up with very similar priorities. And to that point, Nancy Chance, working with Good Samaritan Network in the county as well, sat down, and as they started talking about this, they realized that each one of them, if they, Nancy's connections through the Good Samaritan Network, working with each agency, each hospital would go in and start asking the same questions or requiring that. So from that, a business plan was formed to say, why not work in a collaboration and in a partnership and bring in the Partnership for Healthy Hamilton County and bring in staff. So the hospitals and GSN in kind put the monies together and then are working with that for on a 3-year program. So Good Samaritan is now acting as our 5013C agency, as our fiscal agency, and actually our offices are in their building. So they have provided the in-kind services for us. The hospitals have provided the monies to start. So we are now working with the priorities that were established, and we have 3. We have working with access to health care, which involves transportation, not only getting to the physician offices, but also insurance. How do we get people the available insurance to be affordable? We're also looking at mental health issues that are in the community, the access to those services, as well as improved health behaviors. And then our third area of focus is preventive health. We know that obesity is, we looked at just this morning, there were the reports of the obesity levels, not only in our county, but as a state, we don't rank very well as being very healthy. And, so we're looking at that as well as in the school systems, the rates with asthma. We are seeing increases in the county with those aspects, and that's where we want to look at collaborating with those agencies, not only hospital resources, but mental health agencies, as well as the several that are in the community working on initiatives. And we're a little different in that perspective, is that we're collaborating with the hospitals. It's a pretty unusual thing to say that we can get the hospitals going, and they are also working together to say, go out and find the agencies within the community, also work with businesses. So we are looking all through, and the school systems, all aspects within our community to try and improve that health and move that needle. The second component of that as well is we don't have measurable marked outcomes in our communities. What we do is we lack that resource of that data of information, so that when they go to talk about what's happening in the county, we don't have the specific data points that we have. So part of our goals and the projects that we work with is that as we go through, we will actually measure not only statistically to say we reached 2,000 people, but we want to say what difference did it make, and be able to show that and provide that information back to our civic organizations, our assessors, anybody in the government as well as the hospitals, so that everyone shares that information to make that difference and can speak knowledgeably about it. So that's kind of that brief overview that we have so far.
So my take on it from this, and you know, Nancy and I have had many conversations before about some of the things that are going on in the county and in the city of Noblesville and Fishers and Carmels and northern Hamilton County. Is you're basically trying to coordinate knocking down what I call silos. Okay, you know, I think that there's a lot of organizations in this Hamilton County that do a very good job, but when I came back here 5 years ago, the one thing that I noticed was everyone was doing their own thing, and they really didn't want to share information with each other. Is that am I kind of on the right way there, Holly, on talking?
Oh, I completely agree. I think, as Janet was saying, bringing hospitals together, we both are from a healthcare background. You know, there is always this perception that they do their thing, we do ours. So, you know, that's one of the main things that makes PHHC different, is that we're born of hospitals working together because they have a greater interest in the good of the health of the people in the county. I just came from a meeting, as a matter of fact, from the county health department, and specifically the substance abuse section. And you know, the director, George Christos, said, I used to do things on my own, but now I'm realizing how important it is to work with other organizations. Nobody can do it alone. So no one organization can do everything. So I think more and more people, more and more community advocates, more and more agencies are realizing it's a daunting task. And there's a lot out there that we'd all like to move the needle on. So why don't we do it together?
Sounds great. Well, we kind of run out of time here in the first segment, but we're going to be back here in just a minute, and we'll talk about more about Partnership for Health in Hamilton County.
You know, when Margaret and I decided to sell the old estate here, we had only one choice in signage: Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your next event, or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters, with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
Well, we're back on Hamilton County Newsmakers, and we're in the process of talking about actually a new partnership with for healthy Hamilton County, and we're the first segment we are kind of talking about some of the members in the partnership and also some of the three, I guess, goals or objectives that you have. Let's take each one of those, Janet, one by one and talk a little bit about
Sure.
those.
Thank you. As we've talked about that partnership, and I mentioned in that before that we had also business partners and agencies in the community, and I do want to focus in too, and as we looked at these three initiatives as we're working, we bring to our council that meets with the representation of the hospitals, also Aspire of Indiana, Prevail, we have the youth assistants, and we also are working with the YMCA of Central Indiana. So all of these are on our council, so they also bring their ideas, and also it's critical the input into these three areas. Just to talk a little bit about each one of those, the access to health care is, again, what we found is we had a difficulty of some of our residents finding ways to get to their doctor's appointments. We were hearing back from physicians' offices that at times patients were not able to get there, or they were late. They didn't have a means of reliable transportation. Our dialysis patients have those regular set schedules, yet they were finding it at times they were not able to keep them. So we're looking at ways, certainly looking through what is available within Hamilton County. So we look at the Hamilton County Shuttle Services now that works through the Janus Corporation. We've met with them, looked at kind of what their schedules are and what their business plan is, and we're also working with the transit. Now we have transportation that's going on and plans in Hamilton County, but as that goes out and we're looking at a 2025 implementation plan, we want to look and gather together those businesses in the area that have vehicles that may be able to set up some creative out-of-the-box thinking on ways that we can get our residents to where they need to be in timely fashion. And the other aspect of that is looking for also ways of getting insurance. We would love to be able to say our free clinics, we operate those three free clinics in Hamilton County, but wouldn't that be great if the fact that we had everyone into a primary care provider and they had access to that care when they needed it. So we are also looking, we have champions and navigators that actually work with clients and residents in the county to help walk them through the nightmare that it is of choosing a health plan, one that's affordable, one that fits their needs. Last year at a resource fair, that was a focal point where we had navigators from each of the hospitals that came in, as well as Terry West with his services. But they came in and they sat down in a personal, confidential environment and helped walk those through. When we went back to them a year later, when they were surveyed, each one of those clients said that they were better off than they were the year before from what and how that insurance worked for them. And I think the important point was they had someone to help guide them through answering those questions that do get difficult, giving them the necessary information. So we worked with that. The next one that we have worked with is our improving our health behaviors, as well as our mental health. And Holly could probably address the health behaviors and where we're working in the community as far as improving health behaviors.
Well, I think behavioral health, which is it encompasses a lot of different things, and mental health are two on a lot of people's minds right now. Behavioral health can include many different things, including diet, exercise, also substance abuse, like in terms of tobacco use, alcohol, and drugs. And, obviously working with the YMCA and some of these other health organizations, improving diet and exercise is definitely on our radar. Recently, we have also been looking to, curb the smoking problem, because we are 47th in the state. I mean, we have a lot of smokers still in Indiana. And I don't think a lot of people realize that. We also are looking a lot at substance abuse. We are finding more and more, which is surprising to many people, the escalating problem of heroin abuse in Hamilton County, everywhere. But I think a lot of people have an impression that just doesn't happen here, and so we have attended several forums that law enforcement and other organizations have put on, saying, "Whoa, this really is a problem," and so we are looking to partner with them as well as youth organizations, parental organizations, because obviously the young people are getting the focus, but not just to help those who have the addiction problem, but also, putting the cart before the horse and saying prevention is really going to move the needle in terms of, let's stop it before it starts. And part of that is, where is this coming from? How are people getting it? And what kind of programs we can help facilitate in the community, along with these other organizations that can provide the education to help stop these behaviors.
Yeah, the one thing, and I think back, especially, you made the comment about, oh, it can't happen here, okay? And, and I think back, especially my age and where I am in my life, some of the things that I hear, not only throughout the state of Indiana, but in our own county here, okay? I know that the heroin problem is very, very bad in Hamilton County, okay? And I think it's got to come through awareness and making people realize that it does exist, and you have to do that in a proactive way. So I think that's great that now your law enforcement, you're bringing those type people in, people like George Christo, who has spent many, many years out there trying to beat the drum on his own, and now he's realizing that he needs some help, and we all need that type of help. So I admire you guys for what you're doing on that behavioral side, because just like the situation in southern Indiana on the HIV crisis, because of needles and all that stuff. I mean, people have to be educated about this stuff.
Mentioning that because, and exactly what we're trying to do as being proactive is the fact that needle situation down there and the fact of the exchange, there's differing opinions on whether
absolutely.
The fact that that's going to help or decrease it, but the increase is in the HIV cases has gone beyond 126 at this count. It's even higher. And what they are realizing is that there's some mapping going on, and as that goes, we're passing through to Chicago, people are going down through Cincinnati. The avenues by which people will pass through our county and make stops means that it's not that far up. It will come this direction, and we need to address situations currently and help to advocate to make those changes in the needle policies and exchange policies to lessen that likelihood, or at least the numbers that are going to hit the county. We will be part of that.
Absolutely. Well, we got to take another break here. Great conversation here. We're going to talk a little bit more about healthy people and healthy Hamilton County. So we'll come back in just a minute and talk to Holly and Janet in this last segment.
When Margaret and I decided to sell the old estate here, we had only one choice in signage: Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your next event, or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters, with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
Well, we're back on Hamilton County Newsmakers, and we're talking about a new program which has just been rolled out in Hamilton County. How long, girls?
Well, we've been here since January.
Okay, so it's a new program, and
That was like stereo.
yeah, they do. They had the same story, right? But Partnership for Healthy Hamilton County, and I'll tell you, they're sometimes we we have blinders on sometimes to saying that this doesn't exist in Hamilton County, and I think many times that's harder than when you go in a community that is battered and bruised and know they have a problem and they got to have help. Now our community's got to have help, but I'm not sure that everyone realizes how the extreme this problem is in this county, especially for a county that you consider probably one of the wealthiest counties in the state of Indiana or in the Midwest. But those problems still exist. I mean, drug problems, health problems, obesity, all these things are not financially related. I mean, kids who have everything are still obese, okay, and there are reasons for that. So let's talk a little bit about more, and the one last thing we got to talk about before you kind of let everyone know, Janet and Holly, about how to find out more information about this, but promoting the preventative part.
That preventative health, we're looking at the fact that we know that again, being that evidence-based medicine, that we have the health, the obesity, the foods and nutritions, if we improve that, we reduce the risk of the cancer, the stroke, and the heart attack. And we have those obesity levels are in Hamilton County. A lot of times that is associated with those food insecurities are the lower income or are aged. And that's the other thing, where our county is aging, we want to say rapidly. We know that we have those gray hairs out there, and in some communities, we see that the difference even being between, say, our Carmel and our Fisher and our Noblesville, and then we look to Sheridan, which is part of our Hamilton County. There, the economic income is just a difference of sometimes the average income in say, Carmel and Fisher's is like $86,000. We see that there's $61,000 difference between the income levels that are happening there. And we also see that when we work into those areas, the more rural areas, Arcadia, Atlanta, Cicero, that when we go to Google, what is a fresh produce? Where will they find fresh produce in a grocery store? it's the Dollar General. That's the nearest grocery or accessible for most of those folks. And so what we really are looking there is to say, how do we get that awareness out there as we move through the community? Some people have said, I had no idea. I didn't realize that. So what can we do to make, change the nutrition, improve our health from that aspect, in looking at making accessible fruits and vegetables. We're just with Noblesville, talking with them. Those people that have SNAP in the SNAP program now have access to the farmer's market for fruits and vegetables. We're going to be working on a pilot that involves volunteers going out and working with Good Samaritan in the mobile foods, and working to give them little 5-minute interventions, giving them some samples of testing. What is it like to have fruits and vegetables? Work through that program, use the farmer's market. And again, it's that network of connection, making sure that the more people we have connected to different opportunities will begin to help with that. We're also working with a curriculum in the schools that will be coming up this fall, a pilot program that was with the Hamilton Southeastern School District, where we will actually work with students who will earn credit to go out in a nonprofit, work with the nonprofits, experience it. It's called program-based learning. Well, they actually still do the statistical analysis and the research, but they go out and experience it as well. So we're really excited about that. That will be a program that we're hoping to be involved with in the fall, bring people that have that interest in, push them into that so that they understand what happens in their community and they're likely to return to their community. Because that once you hit the ground running and finding out what the care is and what the needs are and how to help, that's what millennials want to be doing, is they want to know purpose and experience purpose. So we're starting the program and working with them at the high school level as well.
Well, that's wonderful. I know, I guess I'll honk my own horn here, even though it's you guys' show, but Noblesville Main Street, who runs the farmer's market, is working very, very hard on the SNAP program. In fact, we've got a young lady involved from the high school, okay, and she made up these little wooden coins, okay, that has been stamped. That they took care of that project. These innovative students from Noblesville High School took care of that project, and they made us these little wooden coins, okay, and they have us stamped insignia on it and everything to be used at our farmers market. And one of our vendors this past week, because this is really the first week we kicked it off, and he was telling us, because he's deals also with the city market down in Indianapolis, and how he brought over this handful of tokens, which we were very excited for. And he was telling me that in the Indianapolis city market, they have a box about as big as this table and about 2 foot deep of the little type of tokens that they use, because so many people use that SNAP program. So we're very, very excited at the farmers market here in Noblesville Main Street to do that, and that's why we've worked very hard and got that story on Fox 59 this past week. And we want to do, nothing is more. Dave Letterman, I heard an interview from him, and he said probably one of the most rewarding things that he has done in his 30-year career is he's been able to give back. Okay, and I think we all feel that way. Well, we're kind of getting low on time, but I want you to go through on what a person out there listening to the show, how they can get help, or as far as volunteerism, all that type stuff, or get help.
And that's it. What we work with is we have our subcommittees will be on a volunteer basis, so we are looking for all kinds of people. So we have a website. It's www.hamiltoncountyphhc.com. There will be a link and an online form to work with, so that you can either send us a message if you just have interest, and or you can fill out and complete the form. We'll get in touch with you to help build the programs, go out and share the programs. The same way you can go to the website if you're needing help to see what programs are available. Contact either Holly or myself. Again, I said our offices are at the Good Samaritan network, and our phone number can be found on our website. Facebook, jump on Facebook, and we are now on Facebook. We're starting the Twitter, And if in doubt, you can always call into the GSN website as well. So if they're familiar with that particular, Nancy does those blasts throughout all the agencies. We also attend the second Tuesday of the month at the Noblesville, or the East Library, at the Noblesville branch, and we are there, and that's another way of contacting us. Get involved. It's the way we will move the needle on our health in Hamilton County.
Well, excuse me. That sounds great, and I want to let you both know, okay, that any way Hamilton County TV can help you in getting this word out, we greatly appreciate it. I know Nancy has a large base of email addresses and everything. Once Jim gets this on, which will be on demand here in probably an hour or two, to let everyone know, and we'll do it on Facebook and Twitter, and make sure that we're involved with you guys on Facebook and Twitter to get all this information out, because it is truly important that we get on top of this in Hamilton County. And we do have problems here, and we need to fix them, and we need to step up as a community and take care of these. Well, I appreciate you both taking time to be on here today. I'll be back next week on Hamilton County Newsmakers, and I believe I'm on Thursday next week because we got ball games. So I'll be on Thursday at 1 o'clock next week, and we'll be talking about a golf outing that's going to take place to support youth football in Noblesville, and we'll talk a little bit about their golf outing. So this is Perry Williams and Hamilton County Newsmakers, and we'll see you next Thursday.